We will continue with the discussion about the antibiotics. So, we have seen about penicillins, then aminoglycoside antibiotics, and other antibiotics. Now, we will go over to a different category which are effective against both gram positive and gram negative organisms. So, in this category, we have antibiotics like cephalosporins and tetracyclines mainly, and some few other molecules also. So cephalosporins are the compounds which are having a structure which is similar to the 6-APA nucleus of the penicillins. But they were developed because people started either having allergic reactions to the penicillins or because they were developing a resistance to penicillins. So to overcome that side effect, cephalosporins were developed. So depending on the stage in which it was developed, whether it was found very long ago or it is a newer molecule, we classify the cephalosporins as first generation, second generation, third generation, and fourth generation. So in the first generation, we have examples like cephalexin, cephalothin, and cefazolin. In the second generation, we have cefoxitin, cefuroxime, and cefaclor. In the third generation, we have cefotoxime, ceftazidime, ceftizoxime. Okay, and in the fourth generation, we have cefepime and cefpiro. So, based on what is the nature of the infection, the doctor will prescribe any of these. Now, they are very effective because they have action against both gram positive and gram negative bacteria. So, different organism names are given here. You can go through that. The mechanism of action is that they are bactericidal in nature. So, their action is similar to that of penicillin, the mechanism of action. They inhibit the cell wall synthesis. But why is it that they are more effective than penicillin? Because they bind to a protein which is slightly different from the one to which the penicillin binds. So because of that, the organisms cannot develop resistance to the action of cephalosporins. They are used for treating any infection which has grown resistant to penicillin, or as I said, they are used in patients allergic to penicillin. So similar kind of diseases, wherever we are using penicillin, whatever you have written under uses of penicillin, similar diseases and conditions we will treat using cephalosporins. But in patients who have developed resistance to penicillin or those who are allergic to penicillin, we use these drugs. And very commonly they are used to treat urinary tract infection produced by E. coli and Aerobacter. They do have some side effects: skin rash, fever, eosinophilia, neutropenia. Some people may suffer from anaphylactic reaction, although it is quite rare, and there may be renal damage. That is about the cephalosporins. Next category are the tetracyclines. They are also broad spectrum antibiotics, and their activity is different against different organisms. So here there is a list, you can go through that in the notes. What organisms they are highly sensitive to this drug, which organisms are moderately sensitive, right? Like that. Mechanism of action is they are bacteriostatic in nature. So their action is not going to be killing the bacteria. They are going to only inhibit and prevent the further growth and multiplication of the bacteria. So how do they exert this action? They inhibit the enzyme systems, and because of that, they stop the process of protein synthesis. Secondly, they can chelate certain cations like calcium and magnesium. So they bind to the calcium and magnesium ions, and those will get formed into a complex with tetracycline. And when calcium and magnesium is not available for the bacterial cell, it cannot grow further. So that is how they act. And also it has been found that these drugs will interfere with the reactions that involve phosphorylation of glucose. So the metabolism of glucose will not occur properly in the bacteria. Because of all these reasons, the bacteria will stop growing. Now, as we said, one important thing to note is that they chelate the cations like calcium, magnesium, and aluminum, right? So what can happen is the host, the person who is taking this, in that person's body also, they will chelate the calcium, magnesium, and aluminum. So that can have some unwanted effects, especially if a person is going to take milk. Okay, they should not take it along with tetracycline, because that tetracycline may because this tetracycline will complex the calcium which is there in the milk. So because of that, the tetracycline will not be available in the required quantity for absorption of the by the body. Okay, even antacids. When we say that if somebody is there who is taking antacid because they are having suffering from hyperacidity, then in those people, the antacids will contain salts like magnesium salts and aluminum salts. So if they take that antacid along with tetracycline, that magnesium aluminum will complex and form a chelate with the tetracycline, because of which its absorption may be affected. Um, then, although tetracycline was being widely used in the past, now they are not using it so often because they have quite a lot of adverse reaction. There are better products which are available and those are used. Newer derivatives of tetracycline are used. So they cause adverse reactions like skin rashes, intolerance, gastrointestinal disturbance will be there. Then liver damage can be caused, because of which the person may have jaundice. Then there can be some disturbance of the renal function, kidney function will be affected. And very commonly it has been found that tetracycline, it binds to the calcium which is there in the teeth, and because of that the teeth will get stained yellow in color. This is one of the major reasons why it was not being given to young children. Bone changes can be there, and people may develop deficiency of vitamin K. They may develop super infections. Super infection means they already have one problem, and over and above that they develop one more infection. So it can be given in the form of capsules, it can be given as injections. There are also certain ophthalmic ointments and eye drops which contain tetracycline. It is used, or rather it was being used very often in treating rickettsial infection, chlamydia infection, bacillary and amoebic dysentery, and the sexually transmitted diseases or venereal diseases like gonorrhea and syphilis. Now, as I said, because the tetracyclines have all these adverse effects, there are better molecules which have been developed, which are called as semi-synthetic tetracyclines. Now, their action, their antibacterial activity is similar to that of the natural tetracycline. But the disadvantages which are there in tetracycline are not there. So, what are the advantages of these semi-synthetic tetracyclines? They are better absorbed from the GIT. They maintain the blood level for a longer time and at a higher level, because of which they have longer duration of action, and they can be administered parenterally in an easy way. So these semi-synthetic tetracyclines such as dimethylchlorotetracycline, metacycline, limecycline, and doxycycline, these are used nowadays. Then the next molecule is chloramphenicol. Now this chloramphenicol is a drug whose spectrum of activity is similar to that of tetracycline. It can be used against gram-positive and gram-negative organisms. It can be used against Salmonella typhi. Okay? It can be used against hemophilia influenzae, which causes common cold. It can be used against Haemophilus pertussis, which causes whooping cough, and many other organisms. Now, this drug also is having bacteriostatic action, and it acts by inhibiting the bacterial protein synthesis. Adverse reactions of this drug, it can cause some intolerance, which shows up as skin rash, drug fever, and what is called as angioedema, where the person's face will get swollen, then the tissues inside the mouth will get swollen, because of which the person will have difficulty in breathing also. Then one of the important toxicities of chloramphenicol is bone marrow depression. So because of the bone marrow depression, the person will suffer from agranulocytosis, thrombocytopenia, and aplastic anemia. Then one very dangerous symptom in children, in babies who are administered chloramphenicol, is called as gray baby syndrome. Now, what happens is when the infant is there, when the newborn baby is there, they do not have an enzyme called as glucuronide transferase. That glucuronide transferase is required for the metabolism of this chloramphenicol. So, if that enzyme is not present, then these babies cannot metabolize the drug. So, the level of the drug will go on building up in the blood, because of which toxic effects will be seen. So initially the child will suffer from vomiting, Then slowly they will become dull and lethargic. Then after that, the respiration will become irregular. Okay? And finally, what will happen is, because the respiration has become irregular, the color of that baby, if you look normally at any baby, it will appear pink and red in color, right? But these babies who have this problem, they will start, that blood is not getting enough oxygen, so the blood will start having more of carbon dioxide. And you know that deoxygenated blood means it has a bluish grayish kind of color. So that is what is called as gray cyanosis. So that blood, that child's color will start changing. It will start becoming gray in color. That can lead to shock, and the baby may even die. Now, because a baby turns gray in color in this toxic effect, it is called as gray baby syndrome. So this gray baby syndrome is one very important toxic effect of adverse reaction of chloramphenicol. And in some people, it can also cause headache, depression, mental confusion, and peripheral neuritis. It was being used very often in the past to treat typhoid fever, to treat influenzaal meningitis, to treat plague, and to treat conditions like trachoma, whooping cough, and urinary tract infection. But now, because there are better molecules, chloramphenicol is not so widely used as before. It was being given in the form of capsules, oral suspension, dry syrup, parenteral use, ointment. All those uses will be being used. Next category is that of antifungal antibiotics. So whatever we have seen so far, those antibiotics are acting against the bacteria, right? So they were antibacterial antibiotics. So these, now what we are going to see are the antibiotics which can be used to treat infection by fungal organisms. So generally we know that fungal infections may occur on the mucous membranes, they can occur on the skin, or they can also occur within the tissues or in the organs which are within the body, right? So either in some people that fungal infection is the main infection, or in some people it will be secondary to the treatment with antibiotics. So person will have got some bacterial infection, then you will give them antibiotic to treat the bacterial infection, and as a result of that, the immunity whatever changes and the fungal infections will start. I think you remember that during that second wave of COVID, they told that people who were given all those strong immunosuppressants, those people started developing that black fungus. So what happens is when immunity is low, then the fungal infections become very common. So based on the use of the antifungal antibiotics, we classify them. So there is one category which is called as topical antifungal antibiotics. That means they are going to be used topically, locally on the skin or on the mucous membranes. We make use of them. So compounds like nystatin, vimaricin, hamicin, trichomycin, and candicidin. These are all topical use antifungal antibiotics. And then there are some which are given internally. They can be ingested into the body to have a systemic antifungal action. So those are called as systemic antifungal antibiotics. So compounds like rhiziofulvin and amphotericin B are used for systemic purpose. So these topical antifungal antibiotics, nystatin is commonly used. It is having only antifungal activity, but there is no effect on bacteria or on protozoa. Now, if you try to give it parenterally, it will have toxic use. Okay, and at the same time, it is not going to get absorbed from the uh, gut also. From the gut means from the intestine. So generally, what is done is in some areas of the skin where there is some localized candida infections, we make use of nystatin. What this does is it will bind with the cell membrane of the fungal organism, because of which the permeability of that cell membrane will change. So that fungal organism will start losing the cations that will disturb the acid base balance, and because of that, the fungus will die. So it can be given as in the form of tablets or suspension if required, but generally it is given as an ointment or in the form of a vaginal tablet. The candida infections are very common in the vagina, so to treat those infections, we use nystatin. Okay? So sometimes people may develop local candida infection in the mouth also or on other parts of the skin, so it can be given in the form of ointment to treat that. Okay? Then pimericin is also an antifungal antibiotic, and it is generally used in the form of an ointment. It is used to treat what is called as keratitis. So there will be some infection of the keratin layer or the skin, the inner layers of the skin. So that we can use pimarisine. Hamycin is an antibiotic which is it can be given orally. It is used to treat conditions like vaginal candidiasis and thrush. Trichomycin, trichomycin and candidin, these are used again to treat vaginitis which has been caused due to trichomonas organisms or candida organisms. Then coming to the systemic antifungal antibiotics, griseofulvin is an important antibiotic which we use for antifungal action systemically. Okay, it will have mainly fungi-static action. That means it is going to stop the growth of the fungal organisms. How it does these actions? It will interfere with mitosis in the fungi. It will produce some abnormalities during the metaphase in the cell division process, and it will cause disorientation of the microtubules. So because of all these reasons, the fungi cannot grow properly and they will stop multiplying. It is used to treat ringworm infection on the scalp. Scalp means the place of the head from where the hair is growing, or in the groin, right? Groin is the region where the reproductive organs are present. So scalp, groin, feet, hands, and rest of the body also we can use. But that's what it is going to be given orally. It is not applied locally. Although the infection is on the scalp, on the feet, on in the groin and all that, but you have to take this antifungal antibiotic orally to have the action on that organism wherever it may be. And if somebody develops fungal infection of the nails, then also we can give griseofulvin. Amphotericin B is another antifungal antibiotic. And depending on what concentration you are using, it will have either fungi-static action or fungicidal action. It means either it will stop the growth and multiplication of the fungi, or it will prevent them from, or it will kill them totally. So it will have fungicidal action. That what action is there depends on the dose which you are giving. So this is especially used whenever the person has developed some very deep-seated mycotic infection, and it is not this compound, amphotericin B, is not well absorbed from the GIT. So for that reason, it has to be given parenterally. And if you try to give intramuscularly, it causes pain. So it is given through the IV route. Okay. Occasionally, sometimes it is used locally in the form of a lotion, but more commonly it is given as an intravenous injection. Then, now these compounds that we talked about, all these drugs, nystatin, then pimarisine, hamycin, trichomycin, candidin, griseofulvin, and amphotericin B. All these are antifungal antibiotics, means they are obtained from a natural source. Now, there are some other newer molecules which have been developed, which are synthetic in nature. That means they have been synthesized in the laboratory. So there are few important compounds. Okay. Flucytosine is an oral antifungal agent. It can be used for systemic fungal infections. Okay. It is most effective whenever the infection is caused due to yeast and fungi, but it can cause some adverse reactions like alopecia, that is hair loss, bone marrow depression, and abnormal liver function. Then clotrimazole. Now this can be used topically because it has toxic action if it is given parenterally. So it can be used for wherever there is local infection by a fungus. Miconazole is used. It is having antifungal activity. It also has antibacterial activity, and it can be given intravenously in people who have systemic infection with Candida and Aspergillus organisms. Ketoconazole is a commonly used molecule. Its spectrum of activity is similar to miconazole, but the advantage is that it can be given orally. The miconazole, we said, it has to be given intravenously. Ketoconazole can be given orally also. So this was about the antifungal antibiotics. So if you know the three major categories of organisms which infect human beings, we have bacteria, we have fungi, and we have viruses. There are other organisms like protozoa and worms and all that. We will talk about that later. But right now we have finished talking about the bacterial infections. We have talked about fungal infections. So the next category of drug are the once used to treat viral infection. So little bit we have to see about chemotherapy of viral infections. So you must be aware that virus is a special kind of organism. It is different from fungi and bacteria. So viruses are containing just nucleic acid, either DNA or it can be RNA, and that nucleic acid is enclosed within a shell which is made up of protein. There is no cell wall, there are no enzymes, and the virus cannot survive on its own. You know that viruses are all parasites on the host cell. So they have to find a host cell, and there only they will survive and they can multiply and grow. Okay. So what happens is the component which is there, the virus contains the nucleic acids. Similarly, the host cells, if there is a virus which has infected a human being, then the virus contains the nucleic acid. The human being cells also contain nucleic acids. So when we give antiviral drugs, they are not able to make out the difference between the viral DNA or RNA and the host cell DNA or RNA. So that is the reason why often these antiviral drugs have what is called as a cytotoxic effect. That means they will have toxic effect on the human cells also. Now, little newer molecules have been developed where the toxicity is little less, but still antiviral drugs have higher toxicity as compared to antibacterial or antifungal drugs. Okay? Even you may be aware that recently during the COVID pandemic, there were certain molecules which were being used against the COVID virus, right? Against the coronavirus. So whenever that was being used, there were quite a few toxic effects that were produced. So that is the reason, because these antiviral drugs are not able to selectively attack only the viral DNA and RNA. They will attack the human cell DNA, RNA also. So classification of antiviral agents. There are synthetic antiviral agents like idoxuridine, thiosemicarbazones, amantadine, and ribavirin. And there are natural substances which we can use, which are developed in the human body only, called as interferons and gamma globulin. So idoxuridine, it was developed and it was used, but then it is highly toxic. It competes with thymidine during DNA synthesis process, and because of this it will also attack the host cells, so it's very toxic and not much used. It was being used for treating corneal ulceration in patients who have herpes infections and in patients who suffer from herpes encephalitis. Thiosemicarbazones like methicillin are effective orally. They are used against vaccinia and smallpox virus. Now there is not much use for them because smallpox has been eradicated. They may cause some adverse effects like nausea, vomiting, diarrhea, liver damage also. This drug called amantadine, it is more useful as a prophylactic, okay? Because what it does is it will prevent the virus from penetrating into the host cell. So before the virus can attack the host cell, this drug will have an action. So if you want to prevent a viral infection, it is useful as compared to treating after the virus has already attacked it. So it can be used against myxoviruses which cause diseases like influenza, mumps, and rubella. Now, the very common molecule which is being used is acyclovir, because this has selective action. It is little better than the other older antiviral drugs. It will act mostly on the viral cells and it does not have such a bad effect against the host cells. So the toxic effects are less. What it will do is it will inhibit viral DNA synthesis. The DNA synthesis in the virus, it will inhibit that. And it's very effective against the herpes virus. Ribavirin is another compound. It has similar structure to the purine nucleoside, and because of that, it will act against both DNA and RNA viruses. It is used in treatment of a condition called as Lassa fever. This Lassa fever is a type of fever which is generally found in parts of Africa. So to treat that, and it is caused by a virus. So to treat that, they use this ribavirin. Okay. It is also been found useful against influenza virus and certain respiratory viruses. But the only problem is that it has teratogenic effect, and it is also gonadotoxic. That means it will cause toxicity to the reproductive organs. and it is embryotoxic. So if there is a fetus which is growing within the mother's womb, it will destroy, it will damage or cause toxic effects on that embryo. That is the reason why this drug should not be administered to pregnant women. In the compounds which we said, they are natural origin, interferons and gamma globulins. So interferons are certain chemicals which are produced by our human body cells after a viral infection. So if you have had infection by a virus and your body's immune system, in response to that infection, it will produce certain substances to combat that infection. That one category of compounds are called as interferons. Now they will be produced and they will be circulating in our body. So the next time when somebody is attacked by the same virus, these interferons will destroy those viruses. They will not allow them to enter the body and cause any infection. Okay? And because they are produced by our body itself, they don't have any toxic effects. They have been tried in treatment of hepatitis, in treatment of human papilloma virus infections, and in treatment of certain cancers also. They have been found to be useful. Then gamma globulins are certain compounds which are also produced by our immune system. They carry antibodies. Okay, so if somebody has developed a disease, then after some time the antibodies against those harmful compounds will be formed inside their body by the immune system. So these antibodies are developed by patients either who got the disease and they are recovering from it, or if somebody has been given a vaccine. If they have been immunized against the disease, then when you give the vaccine, the body will develop antibodies, which are a part of the gamma globulin. So these gamma globulins have been used in prophylaxis, prevention of diseases like measles and infectious hepatitis. So this is about the antiviral chemotherapy. So we will stop here for now, and next time we will continue with certain other parts which are there in chemotherapy.